Welcome to the New Health. As people are getting sicker and sicker at younger ages, we are bringing in thought leaders that are revolutionizing healthcare and changing the world of health. I'm your host, Jessica Preston. Here with us back today is Dr. Andrew Sun, men's health urologist at Urology Partners of North Texas. Thank you so much for being back with us today.
Always good to be here.
So today, let's talk about the erectile dysfunction issues that we're seeing globally, actually, at this point in time.
Yeah, big topic, right? Erectile dysfunction, easily defined, inability to attain or maintain an erection, right? It can be both. And the first thing to say is that this is one of the most common things that men will experience. The incidence of erectile dysfunction is essentially the same incidence as a man's age. 20% at 20, 50% at 50, 80% at 80. I don't think there's a 100-year-old guy out there that doesn't have some erectile dysfunction, right? So inability to attain or maintain, essentially a good enough erection to use, to have penetrative intercourse, we normally would define as, but it can be a variety of different types of level of erectile dysfunction. Mild, moderate, severe, you could argue that definition is going to be different for different people, but super, super common.
Okay, so tell us, when somebody presents to you, this is one of the most common reasons why someone comes to see you, especially at younger ages to see, or?
Now, well, most ED, I would say, is more pronounced as men get older, right? Because the common causes of erectile dysfunction are vascular, hormonal, neurological, and psychological. And most of the time when an 80-year-old guy comes in with a history of a heart attack and diabetes and a stroke and stuff, he has vascular, hormonal, and neurologic issues. I am seeing a lot more younger men, 19, 20, 21, 22, they're coming in with erectile dysfunction. More likely that is going to be a large component of psychological, right? It's going to be anxiety. And I don't tell people like, hey, it's all in your head or something like that. You have to validate their concern, because indeed the psychological response to stress, the body doesn't understand that as a thing, right? It only understands like parasympathetic and sympathetic, flight or flight. So anxiety is a form of the flight response. And so what it does is it drives your system away from things that your resting body doesn't need, intestines, penis, to your heart, to your muscles. Evolutionarily, your body learned this response to like run away from the lions before they would eat you. Now you're having that same response during sex, during a partner situation, because you're afraid of judgment and these kinds of things, and it will definitely present as erectile dysfunction. But you could argue a lot of that requires counseling and sex therapy and psychological help.
So you do this, they come in and you validate their concern, you check otherwise, testosterone levels, all of the other, which are blood, vascular, and vascular, neurologic,
and hormonal.
And hormonal.
Yes. And maybe 40% of men with erectile dysfunction will have low testosterone, so we check that in basically everybody. Common misconception is that the treatment for ED is testosterone. It's not. It's a critical component, but testosterone mostly controls desire, libido, sex drive, not actually the blood flow to the penis, right? So testosterone is necessary but not sufficient for erections. Vascular is by far the biggest one. The most common causes of erectile dysfunction are all vascular, right? They're high blood pressure, cholesterol. Anybody that comes in with a history of a heart attack and he's like confused about why he has erectile dysfunction, and I tell him, well, the blood vessels in your heart are this big and the blood vessels in your penis are this big, so if you had clot and obstruction in the big one and you got a heart attack, of course you also have that in your smaller vessels in the penis as well. That's why we'd say the penis is the check engine light or the canary in the coal mine, because usually ED precedes heart attacks and strokes and those kinds of things. And then neurological, diabetes is the big one. Hugely prevalent, huge problem for erections. Best way to kill a penis is diabetes, unfortunately.
Oh, wow. The best way to kill a penis is diabetes.
And they should put that on the billboard.
It should be on a billboard. I think that's right.
Yeah.
So vascular, I think it's really important to remember that when we're looking at heart disease and we're looking at blood vessels anywhere, those blood vessels are going to be mimicked everywhere in your body, whatever the disease state. We just focus on the heart.
Yeah.
So thinking that if you have some erectile dysfunction, the first thing you should consider is what else is going on in my body, such as how is my heart.
Absolutely.
Going from there.
Absolutely. And then anything that would affect blood flow, so nicotine, smoking, definitely a big one, right? They should also put that on the smoking packs, like kills your penis.
Yeah.
Stop smoking.
Yeah, they probably would stop smoking, that's it. That's it. So what do you do when somebody comes in? And I mean, it looks like you are controlling a lot with some lifestyle medicine and some factors such as weight loss and maybe some stress management, sex therapist, you had said.
For sure.
This getting good sleep we had mentioned before, so those lifestyle factors.
Mm-hmm.
And we talked a bit about testosterone replacement, but you said that doesn't actually have any place here.
Not a
really.
huge place. It
Yeah.
does, maybe 15-20% of the picture. And so if a guy has really low T, they will not respond to Viagra and Cialis and those kinds of things as well as they will if they have normal T. So if they have low T, we fix that. Lifestyle management, diabetes control, blood pressure management, all of those things, important. A lot of men will actually say that, hey, but it's my blood pressure medication. After I started taking that, then I got ED. And they're not wrong, because if they had high blood pressure, their blood pressure has slowly increased. Let's say it's like 160/90, kind of high. Their penis is now used to 160 pressure. You suddenly drop that by taking a pill to 120. There's not as much pressure going into the penis. They feel ED. There's actually like 20-30% of men that will stop taking their blood pressure medications because they get ED. But the problem is if you sustain that high blood pressure all the time, you're going to blow out the system and get ED anyway. So, people will encourage you to still take your blood pressure medication. But we have that piece of it. And then we have our treatment ladder. And, you could think about this as like a platter or a menu. I think of it as like a menu that exists on like a ladder, and my job is to guide the patients up the ladder. And so I tell people there are 3 things you can do for just about any problem in medicine outside of lifestyle management. You can take a pill, you can inject something, and you can do a surgery. Yeah, that's pretty much it, right? And so for the penis, you basically have those 3 options as well. You can take pills, Viagra, Cialis, Levitra. Most of these are generic now. They're very cheap to get. You can get them, from your doctor. There are a lot of online pharmacies that do this. Fairly effective, but more for that sort of mild ED category. One step up from that would be trying to do something that is, like an injection. So you can inject the penis with a medication. It sounds wonderful, I know. It's not as painful as it sounds, but nobody's telling me that they love doing this, right? You inject the penis at the time of having sex, you get an erection, it works. And then the other treatment option, the most invasive but most effective treatment option is a penile implant, which is actually only about a 45-minute surgery where we implant a silicone implant into the penis that's a balloon, and you essentially get a third testicle that's a little pump, and when it's go time, you basically reach down and you grab the pump and you actually manually pump up the penis with saline. And it works really well, and it's a great treatment option as well. That's the classic therapy ladder. There are also some new things that people may hear about. Probably the most commonly known one is something called penile shockwave therapy. Goes by a lot of names. This is something that was started in Europe maybe 15-20 years ago. It's a little handheld probe. You put it on the penis and it sends shockwaves through it. Now there's a big difference in the types of shockwaves, the type of machines, and the legitimacy of whether or not these are actually like good therapies. Basically, there's real shockwaves and there's not real shockwaves. So real shockwaves have fairly good data. They're well studied, good clinical trials in Europe and in the US. In the US, this is still considered experimental, so it's not covered by insurance. In the European Union, it's actually in the European Association of Urology guidelines. But it can be a good therapy. It helps revascularize the penis by basically stimulating the penis to kind of build new blood vessels. Works best in those mild to moderate ED guys. But you have to be sure you're getting it from a reputable provider at the right place, and they're using a specific type of shockwave called focused linear shockwave therapy, not radial waves or unfocused waves or some of these other things.
So let's talk a little bit about shockwave. You do shockwave therapy.
Correct.
In your office.
Yes.
Now, you hear shockwave and you think electric.
Yeah.
Does it have any sensation?
Not
Do people
painful
feel
at all. I mean,
can
you
people feel it?
You can feel maybe like almost like a rubber band snappy sensation.
Okay.
Nobody needs medications or anesthesia. It's not painful. Luckily, there is truly no medical downside to shockwave therapy. You cannot hurt anybody, and 40 to 60% of patients or people will improve about 40 to 60%. So I kind of tell a guy, look, if your erectile dysfunction is like a 7 on a 10-point scale, so you can get like a 7 out of 10 erection, whatever you think that is, shockwave is reasonable, because I might be able to get you from a 7 to a 9 or a 10. If the best you can get is like a 2 out of 10 erection, like barely anything, shockwave is not going to be the treatment for you, right? That patient needs something a little bit more definitive, like a penile implant or injection procedure.
So what series, how many times do you have to have a shockwave treatment?
Usually, so if you follow the published data from Europe, it's 6 treatments. That's what's been validated. Once a week, it only takes about 20 minutes. Like I said, what we do up in our clinic is we use what's called a Storz device. It's from a German company that originally helped kind of invent this procedure. Focused linear shockwave therapy. Be wary, there are a lot of versions of this that you'll find out there and online and in little places that may not be quite so legitimate. So you just want to make sure to do your homework before you sign up for these things, because shockwave therapy is a cash procedure. Pills like Viagra and Cialis, or the generic forms sildenafil and tadalafil, super cheap. You shouldn't be paying more than a few pennies a pill. Injections, $5 an injection. Penile implants, they're expensive, but Medicare and other insurances do tend to cover them. So if you're Medicare age, 65 or above, penile implants are actually free because it's totally covered.
That's great to hear, so that can help people in so many ways.
Yeah.
So no home shockwave devices.
I would not recommend using the home shockwave devices because I do not believe they have enough scientific evidence to support their legitimacy.
Okay.
Yeah.
All right. Well, that's really good to know.
Yeah.
So thank you so much for being with us again today. Would you please let everyone know where they can find you and what you're working on right now?
Sure. So our practice is called Urology Partners of North Texas. We're up in DFW, 7 locations. I direct the Men's Health Center, where we just treat men with sexual dysfunction and fertility concerns. You can find us on www.upnt, urologypartnersofnorthtexas.com. I am a member of an organization called the Sexual Medicine Society of North America. We do a lot of the sort of research and guideline writing for sexual medicine around the country. A lot of us are very interested in this sort of, we call it like regenerative medicine space in terms of erectile dysfunction. The existing therapies, which are great, implants, injections, they're all compensatory or replacement therapies. The real holy grail is to find a restorative or regenerative therapy. And so a lot of the research is being done on things like shockwave and hopefully stem cells and various things in the future. With time, I think we'll get there.
That's great. Thank you for the information.
Yeah.
This is really valuable information on erectile dysfunction. I know it's growing.
For sure.
That's it. This field is. So thank you. We'll see you again next week with us. And please stay tuned after these messages for our next guest.